Among rheumatic diseases, the diagnostic methods for rheumatoid arthritis, which can be considered representative, have advanced significantly compared to the past. Currently, the classification criteria for rheumatoid arthritis, established by the American College of Rheumatology in the year 2010, are being used for diagnosis. In 1987, it was mainly symptom-focused, like morning stiffness, whether there is early morning stiffness, whether there are rheumatoid nodules, and whether there is bilateral joint pain. And they used to diagnose by checking if the rheumatoid factor appeared in blood tests. But now, with the revised classification criteria from the 2010 American College of Rheumatology, inflammation markers like ESR or CRP have been added. In addition to the rheumatoid factor, anticyclic citrullinated peptide antibodies, also known as anti-CCP, have been added to the classification criteria. Although not included in the classification criteria these days, joint ultrasound examinations are mainly used to determine the extent of arthritis and which joints are affected. We have reached the stage where we can identify this, and with X-ray examinations, we can see how much the bone has been damaged due to inflammation. Of course, such bone erosion can be checked with joint ultrasound, but it can also be confirmed with X-ray. So, along with various blood tests, and we diagnose rheumatoid arthritis by combining radiological tests, symptoms, and physical examination findings. But there are cases that fall outside these classification criteria. For example, there are cases where there are symptoms of rheumatoid arthritis, but the inflammation levels in the blood test are normal. Even though the joints are very painful due to rheumatoid arthritis, there is also seronegative rheumatoid arthritis without antibodies, and in some cases these antibodies there are cases where the inflammation markers are normal, but when an ultrasound of the joints is performed, a lot of inflammation is present. Therefore, rather than diagnosing based on one or two findings, it seems most important to make an accurate diagnosis by considering various findings together in diagnosing rheumatoid arthritis. Since diagnosis can involve some subjective elements and may vary depending on clinical experience or such factors, for example, just because a blood test is clear, thinking, oh, it's definitely not that, or if it outwardly appears to be degenerative arthritis with many protrusions at the fingertips, and the person is elderly, thinking it just looks like degenerative arthritis and not rheumatoid arthritis. In some ways, the preconceptions or clinical experience of the person making the diagnosis can influence the diagnosis. In my opinion, it is essential to perform a joint ultrasound examination to confirm whether there is truly no inflammation in the joints for the diagnosis of rheumatoid arthritis. It could be considered an important point because even if a joint doesn't seem swollen when felt by hand, there can be inflammation when checked with an ultrasound. And then when felt by hand, it definitely seemed like there was arthritis, but when viewed with ultrasound, the joint was not swollen and only the outer part of the joint was swollen in some cases. So making a diagnosis through accurate testing seems to be an important point. 1987. The diagnosis based on that method was symptom-focused. So in cases where symptoms were mild or not yet apparent, such as in the early stages of rheumatoid arthritis, the diagnosis was often missed. But according to the current classification criteria, rheumatoid arthritis can be detected earlier, and early rheumatoid arthritis can be although it is said that it has become a time when early detection and treatment can reduce complications, the early diagnosis of rheumatoid arthritis is still not as satisfactory as it could be. First of all, it seems most important to suspect whether it is rheumatoid arthritis or not. If rheumatoid arthritis is suspected, it seems important to undergo tests to receive an accurate diagnosis. A patient was an elderly male around in his 70s
He had been suffering greatly from unexplained itching, skin itching for about 5 years, to the point where he couldn't sleep well at night, and he came to our hospital. First, we conducted various tests to see if there were any other causes of the itching. There was nothing special found in allergy or similar tests. Mainly the immune system was weakened and the adrenal function was reduced. And there were no other causes like medications that could cause itching. So through stem cell fluid therapy, this kind of a type of allergic reaction. Since itching can also be a result of an excessive immune response, we administered stem cell infusion therapy and other infusion treatments that could help with the itching to regulate the excessive immune response and return it to its original state. And through medication, we use drugs to alleviate the itching, and additionally, this patient also received herbal medicine treatment that could help with such itching, skin itching. And on the day of the visit, stem cell infusion therapy helpful for itching, and medication treatment were administered, and from that day the itching was not severe, allowing for sleep. The next day the symptoms improved by more than 50%, and they were hospitalized for about 5 days, and at the time of discharge about 10 to 20% of the itching remained. Currently they are receiving outpatient treatment and the itching has almost disappeared, which they are very pleased about. There was one such case, and another person was she was a woman in her 50s, and after receiving a cosmetic procedure on her face, she applied something like a bandage. During the process of removing this bandage, her skin was slightly damaged, leading to severe facial flushing. She suffered from this facial flushing for a long time, for about 1 year. At first, the patient underwent inpatient treatment. However, this person did not start with stem cell infusion therapy from the beginning. Initially, they showed some improvement with medication and infusion therapy that helped with facial flushing, but there was no further improvement. Over time, the flushing tended to recur, not as severely as at first, but still repeatedly. After undergoing treatment for over a month, I recommended stem cell infusion therapy, and they underwent stem cell infusion therapy. And while undergoing stem cell infusion therapy, we also directly injected stem cells into the facial flushing area. And since then, the flushing has significantly subsided and has not recurred. Currently, she is receiving outpatient treatment and is doing well, much improved from the initial state. Another patient was a rheumatoid arthritis patient, and the inflammation was so severe that there was no joint in the body that wasn't painful. Of course, anti-rheumatic drugs that help with rheumatoid arthritis were used, but through stem cell infusion therapy, inflammation was alleviated more quickly. And since stem cell infusion therapy also has regenerative effects, it could help prevent joint deformities and such. So there is actually a person who is doing well with reduced inflammation. Therefore, some stem cell infusion therapy can be helpful for various conditions, so it might be applicable for rheumatic diseases or skin conditions. In some cases, even if there are no such diseases, it could be an alternative for those suffering from severe chronic fatigue and weakened immunity. However, having systemic pain does not necessarily mean that hospitalization is required, but in such situations, even short-term hospitalization can be through this alleviate pain and reduce inflammation. Yes, among those experiencing full body pain, there are people who have had it for 20 years and others who have developed it recently, like about a week ago. Usually when we see these people, they have a diagnosis of fibromyalgia. During the time treatment was done for rheumatoid arthritis, but the rheumatoid arthritis was not well controlled and spread to full body pain. In recent cases of pain, stress can lead to autonomic nervous system disorders, causing symptoms like tingling in various parts of the body. In cases of such widespread pain, sleep disorders, chronic fatigue, depression, anxiety, and even panic disorder can occur, significantly reducing the quality of life. In such cases, a short outpatient treatment is often insufficient, and in severe cases, an environment for intensive inpatient treatment is necessary. It's not just about staying in the hospital room for treatment. We also manage pain, control inflammation, and regulate sleep. In cases of severe widespread pain, we often recommend inpatient treatment. However, having generalized pain does not necessarily mean that hospitalization is required, and in cases where the pain is mild, treatment can be done on an outpatient basis. However, in such cases, hospitalization might be actively considered. So, if the pain is severe enough to prevent sleep, or if symptoms do not improve despite continuous medication and treatment, leading to decreased energy and a depressed state, then hospitalization might be a better option. In such situations, I think it might be helpful to alleviate pain and reduce inflammation through short-term hospitalization to help recover one's condition. During hospitalization, various treatments can be received, but through examinations, the overall physical condition can be assessed and the cause of the pain identified. Well, whether it's rheumatism, nerve pain, or a physical cause, we identify it and can provide various treatments depending on the cause. The most common treatment is using fluid therapy to adjust the overall condition, especially when rheumatic inflammation is severe or when energy levels are very In cases where it is low, stem cell infusion therapy can be used to more quickly alleviate inflammation, and direct injection therapy can be administered to areas with severe inflammation or pain to quickly reduce inflammation and relieve pain. In cases of severe swelling, treatment with extracorporeal shockwave therapy can help reduce the swelling more quickly and alleviate pain. If there is an imbalance in the spine or abnormalities in the joints, manual therapy or physical therapy can be considered for treatment. In addition, for muscle abnormalities or various other issues, acupuncture or herbal medicine treatments can be provided. In cases of autonomic nervous system imbalance, injection therapy to restore balance can also be considered. During the hospitalization period, symptoms can be frequently monitored and responded to quickly, so in cases of severe body pain, inpatient treatment may be helpful.
Yes, there are people who have been diagnosed with fibromyalgia and have been receiving long-term treatment for fibromyalgia due to chronic widespread pain. Among these individuals, upon thorough examination, there are cases where they actually had pre-existing rheumatoid arthritis or polymyalgia rheumatica rather than fibromyalgia. Today I will talk about that part, yes. Rheumatoid arthritis can also cause widespread pain, and due to rheumatoid arthritis, if only the hands hurt, or if the hands and wrists are swollen and painful, it is rarely diagnosed as fibromyalgia. But as rheumatoid arthritis symptoms worsen, it can lead to widespread pain, with joint pain throughout the body. In advanced cases, the symptoms may appear as fibromyalgia. There are parts that can be mistaken, and in cases where it is rheumatoid arthritis but blood tests show normal inflammation levels and no rheumatoid antibodies, it is even easier to misunderstand it as fibromyalgia. However, since fibromyalgia itself is fundamentally a diagnosis of exclusion, rather than definitively diagnosing it as fibromyalgia, other conditions that can cause widespread pain, for example, occur. Rheumatoid arthritis, polymyalgia rheumatica, autonomic nervous system issues, or hypothyroidism. After excluding these various conditions, if pain is spread throughout the body and appears severely, then it can be considered fibromyalgia. But first,
Even if fibromyalgia is suspected, it is most important to confirm through accurate examination and tests whether it is an inflammatory disease. So, when diagnosing, just like diagnosing rheumatoid arthritis, blood tests are conducted, such as inflammation levels, antibodies related to rheumatoid, hormone tests, liver function tests, and anemia levels. These basic tests are performed, and radiological tests, joint ultrasound, or X-ray examinations are conducted in order to accurately identify these areas of widespread pain. Sometimes an infrared blood test is conducted. So after examining the possibility of various diseases through these tests, it seems that judgment can be made regarding fibromyalgia.
For example,
Now, if symptoms like swelling and pain in small joints, such as fingers, persist, or if a blood test shows consistently high inflammation levels, or if rheumatoid-related autoantibodies appear, or if symptoms improve after taking steroids, in such cases, an inflammatory disease like rheumatoid or arthritis might be suspected. So it seems important to check if it is rheumatoid arthritis. In reality, there are cases where it is rheumatoid arthritis, but people have been treated for fibromyalgia for a long time. These individuals often visit psychiatry, pain medicine, and rheumatology departments, resulting in a large number of medications. Despite this, their symptoms remain uncontrolled, insomnia worsens, and fatigue becomes severe.
now the depression is also severe.
Some people come after that and then they are diagnosed with rheumatoid arthritis again and use rheumatoid arthritis medication, improving insomnia or fatigue. If we do that, then those 10-year, 20-year cases, even if it is rheumatoid arthritis that was mistakenly diagnosed as fibromyalgia, improvement tends to occur relatively quickly. Therefore, regardless of the period since diagnosis, it is most important to accurately confirm the diagnosis once more and receive the correct treatment. When diagnosed with fibromyalgia, I think it's always important to have doubts. So today I talked about the differences in diagnosis and symptoms between fibromyalgia and rheumatoid arthritis. If you have any more questions, please leave a comment and I will respond.